When I was young, there were no schools, no creche, no awareness. My mother died at childbirth because there was no hospital to take her to. When I was sick, there were no health workers coming to the village. We had no awareness about our reproductive and sexual rights. We had no information about government schemes under which we could demand better facilities, resources, and support. It was difficult for us to find accurate information about preventing common illnesses, taking care of pregnant women, or ensuring fulfilling childhoods for our children. We didn't have clarity about adolescence or how we should deal with young people. Today, a lot of this exists. My children's lives will be a lot better. They should be a lot better. Chetna means awareness in several Indian languages. For us, it means Center for Health Education, Training and Nutrition Awareness. Chetna's mission is to work towards empowerment of disadvantaged women, adolescents and children.
Basically, we believe that the patriarchal society really has given a secondary status to women, and just by telling her, for example, to eat more food is not going to lead to an action unless she is really empowered with a decision making capacity. What we do is, through a process of discussion among themselves and then looking at what their needs are, we try to give them solutions. Not give them solutions, actually the solutions emerge from their own discussions. Chetna tries to empower people who are working with communities, and that includes both the government and the non-government sector. Because we believe that, the grassroots NGOs do know their communities better, but what they lack is some perspective and some technical knowledge. So what we do is empower these NGOs and community-based organizations with this perspective and technical knowledge, so that then they can decide for themselves what is good for their communities.
We make policy makers aware of community level problems and make the community aware of policies which affect them.
I see Chetna as a growing organization which has tried to take the scientific messages on nutrition and health and reach them to the rural communities through various innovative communication methodologies, technologies. In the process, they have also tried to develop the capacity of various NGOs working with them. One of the key things Chetna has been active in the last few years is to do advocacy with various governments at various levels and also at international level related to women's health, nutrition and women's empowerment. They have tried to also do things on micro level, such as running adolescent health clinics, running women's health groups in rural areas, and this has given them the understanding of what are the situations in rural areas, which they have then used in their training, dissemination and advocacy work.
Chetna produces need-based, situation-specific, field-tested, gender-sensitive educational materials like flip charts, posters, reports and studies. We also publish regular newsletters in English, Hindi and Gujarati. These reach out to numerous stakeholders in NGOs, government, healthcare and education. We value and listen to trainees' experience and their knowledge in the training process. We do not discredit their traditional knowledge or practices. We understand their methods in their local context and then promote some of the sound practices through our trainings and publications. This is one of our strategies for the empowerment of women. Our approach is skill oriented and participation is the key. We contribute to the lives of Nathi Ben and her children. After the trainings, they feel confident about taking care of their own health, that of their family and of the community.
At the national level, they are very well recognized, and we work together as a network. And Chetna is a member of the Health Watch team, and she done some good work on child's rights, with which I was very closely associated. I was also an advisor on that project. They've done a really good piece of work, and I think it should be publicized. And what advocacy material that they should draw out of that child rights work that they have done, which was really evidence-based piece of work that they have done.
At Chetna's Child Resource Center, CRC, and Women's Health and Development Resource Center, WHRDC, we have numerous ongoing projects. At our Shahibag Center in Ahmedabad, we have Leelavati Lalbai Pravati Kendra, the LLPK. Here, we work to empower women and adolescents from nearby slums. We have various programs here which offer support and guidance on health, livelihoods and nutrition. At Chetna, we are in constant touch with the ongoing processes in the field. This knowledge helps in constantly advocating for change in the policies and perspectives of the government. Over the years, we have developed a variety of educational material. Different materials meet different needs. To ensure that this material is used effectively, workers need to be trained in its use. From our experience in the community, we assess the need, develop the package, and select the appropriate medium. We draw our visuals from everyday life in community activities. They are simple, use simple local languages, and the visuals are given prominence. The materials are field tested in terms of visuals and language. After integrating the community level learnings in the publications and training modules, we share our experience by giving training at the supervisory level. At this training, we have project coordinators, health trainers, teaching trainers, communicators. This training equips them with health knowledge and training skills. Many participants request additional training to update their knowledge and improve their skills as trainers. We have had numerous partnerships with the government.
I've been working as Commissioner of Health Department for the last 2 years, and in that capacity I have interacted very closely with the NGOs in Gujarat. Gujarat is in any case blessed with some very good NGOs, and one of the better NGOs amongst them has been Chetna, which is a very good group of women who have been working in the field in the districts, various districts of Gujarat with the women at the field level. Some of the things which I found most impressive about them is they have been able to get the field reality, what's really happening in the field, in the health sector and in other social sector programs. And simultaneously, because of their good networking with the government and other policymakers, they've been able to bring those realities into policy making, so that there is a wider effect of what they found. The second thing which I've been most happy about working with them is we have found them to be a very good resource for training our other NGOs. They are our regional resource center for training the mother NGOs in the state of Gujarat. We have just found a DAI Sangathan in the state of Gujarat with some of the good NGOs in the state, and Chetna is playing a leading role in it. The idea is to accredit good training institutions for training the DAIs, and then kind of certify the DAIs that they are trained to handle issues of reproductive health. We have also found in the field of reproductive and child health that they have very good skills in communication. They have used local material and local folklore to educate the masses on various health issues.
Here, the Chetna team demonstrates the participatory approach to the teachers of a voluntary organization. It is a reflection of how we have made our program sensitive to child rights. Here we are focusing on the right to participation. It is a rally on health and nutrition messages. Children are effective health messengers for themselves, their family, and the community. Chetna has realized the strength of this and has had active child-to-child programs for many years.
The training helped us to reduce our fear and nervousness. We were shown how to prepare charts and posters and teach children practically. I realized that if practical methods were used to teach children, it would help them.
The test of the training is the trainees. And our trainees who are trained by Chetna still remember Chetna very much. And they have no hesitation to say that they did learn a lot of things, practical things. And they have been able to teach it not only to their family members, but also to the community.
In
the beginning, whenever the children saw me, they used to run away. But after the training, I felt that things have changed. Now when they see me, they say, Ben has come. They have gained confidence in me and listened to me. In the training, I learned how to weigh, how to deal with the children, and I gained confidence. I want to tell other creche workers that we should keep doing our work with motivation. There is a need for training, and over the years, training the creche workers, the teachers, trainers, communicators, we have started to see the impact. It is a slow process, and we have reached out only to a limited community. So we have trained the trainers of creche workers, the trainers of teachers, the trainers of supervisors, and have built resource centers like the Child Resource Center and Women's Resource Center. This way, we share our experiences with many others. We support other organizations in developing their technical, management, and resource bases. Being one among the 10 regional resource centers in the country, we are working with organizations in Gujarat, Daman and Diu, and Dadra Nagar Haveli.
सिर्फ हम गांव वालों को बोलें कि आप ये खाइए वो खाइए जैसे हमारे न्यूट्रिशन कैंप्स में होता है तो कुछ फ़ायदा नहीं होने वाला. दोनों तरफ से चेतना जगाना बहुत ज़रूरी है. तो चेतना को मैंने ऐसे विजुअलाइज किया है एक ब्रिज की तरह.
Our dream is that we will help to fulfill Nathi's dreams, that her daughter Rekha's life will be better, and that Rekha's daughter's life will be much better.